Good afternoon, everyone. Welcome to another Facebook Live. And how absolutely wonderful to have had some rain. I feel truly blessed. It really is wonderful to experience the rain in Africa in particular. Our ground is so dry. It's absolutely just gorgeous and phenomenal. And I'm truly grateful and excited and hoping for more. But I always want to start with something. But today we're going to be veering off from a lot of the usual topics that I tackle, and we're going to be talking a little bit about allergies. And allergies in people are particularly rife. I mean, right now, prior to the rain, with all of the dust and all of the pollution in the air, I've certainly my nasal passages and my sinuses and post-nasal drip have been playing up, and it's no different for our canine companions. If any of you have ever had an itchy dog, you will know how frustrating it is to try to find the correct combination of things that will bring quality of life for your dog. I mean, some of these dogs are just so incredibly itchy, it's almost impossible for them to sleep. And if they're busy scratching in your room, because most of the dogs sleep with us, then it's nigh on impossible for you to sleep as well. And I just wanted to cover some of the basics today, and we'll see where we get to, because it's an enormous topic, and I think it's a very misunderstood topic, and it's a topic where sometimes as vets we take the easy way out largely because of financial restrictions. But I do want to bring to the fore some of the changes and some of the new medicines that are available for treating allergies. And I think it's important because in traditionally, when I graduated, our mainstay drug was cortisone, and cortisone in the long term has many detrimental side effects. So if we can avoid that, we should definitely try. So I think we have to start with, hello Christine, thank you. Somebody's said something in my comment that means I truly am live. I think what we need to start with is, what is an allergy? And we have to be looking at the response in the body, as well as what we would term, what you would refer to as an allergy. So there are a number of different things that need to be taken into consideration, and that as vets we need to be able to distinguish between them, because often the treatments are different, and we need to understand that in order for us to make a correct diagnosis, we need to spend some of your money on some diagnostics, and that way we can treat your dog more appropriately for whatever the problem is. Okay, so the more likely we are, or the more we can get, the closer we can get to a diagnosis, the better we're able to treat as a veterinarian. Okay, so an allergy is really an overreactive immune response. So our immune systems are designed to protect us from substances and things that are going to cause us harm. And an allergy is an immune response to a substance which is actually not harmful. So some message system in the body is faulty, and as a result of that we become super sensitive, or we become hypersensitized to that item. So it becomes very important to distinguish, to know what it is that we have to separate from the allergy. So this allergy, where we have itchy skins in dogs, is often caused by something that the animal breathes in. Okay, and then the body says, oh my gosh, that pollen or that grass or that dust mite or that particle, those are the most common things, we can't deal with it, and we're going to completely overreact to having it in our system. So if any of you are allergic to bee stings, you'll know you got stung the first time, nothing really happened, maybe a bit of itchiness, a bit of swelling, but that sting primed your body. And if you are one of the people that is prone to go into hypersensitivity, then the next time you get a bee sting, that reaction is going to be much bigger. And the third or fourth time you get a bee sting, if you haven't attended to it, you may well go into anaphylactic shock because of the release of all of the histamine and all of those particles that are brought on by the overreaction of your immune system. So the first time you get stung by the bee is when your body is exposed to this particle or this toxin or whatever it is, and your body then forms antibodies. The bee sting venom is a body, and your system develops an antibody to that bee venom, and it then stays as a memory within your immune system. So the next time you get stung by a bee, your body goes, yes, we know what this is for, and they send in the army. And as a result of that, you get a much, much bigger inflammatory reaction than what you did the first time. So when we start talking about allergies in dogs, the constant exposure to, hello Marty, the constant exposure to allergens constantly stimulates the immune system, and we get overproduction of antibodies, and a complete immune response. Okay, and those allergens of which I'm now speaking will create that itchy pruritic skin in your dog, and we refer to it as canine atopic dermatitis, or atopy, ATOPY. Okay, it's a specific reaction that happens in the body. But we can get excessive pruritus and itching if the dog has a flea allergy dermatitis, and that is it's a similar reaction in the body, but it's a different classification of allergy for the dog. So if the dog is itching, one of the first things that we have to do as a vet is we have to say, are there fleas? And fleas are not always visible to the naked eye, and if your dog has a flea allergy dermatitis, one bite, that saliva is going to trigger the response, and your dog is going to go into overdrive. So it's vitally important, if we know my little dog has a flea allergy dermatitis, if I don't adequately manage her flea control program, and she starts getting itchy, the first thing I do is go, oh, am I overdue with the flea control? If I am, the first thing I do before I do anything orally is I treat for fleas, even though I can't see them on her. Okay, the bulk of the flea population is not on the dog, it's in your environment. And that's another completely different topic. But we need to make sure that what is causing the itching is not a flea allergy dermatitis. So please don't get frustrated with your vet when they say, have you got any fleas? And it's not an insult, it's a process through which we have to go to eliminate before we start putting your dog onto medicines that are going to manage an atopy or an atopic problem, allergic problem. Okay. The second thing we have to look at is what is called cutaneous adverse food reactions. So cutaneous is your skin. All right. So what is the dog eating that is causing an adverse or a bad reaction that also presents as an itchy skin? Okay, and so you will see that many vets will put your dog onto a dietary trial. Okay, that is, it used to be 6 to 8 weeks. I think it's now as long as 12 weeks. Forgive me if I'm not completely up to date with the newest medicine, but I don't treat in that field anymore. But a dietary trial is when we put your dog onto a single protein source and a specific diet. So Hills makes hypoallergenic, which is a specific process. Eukanuba probably also has an allergy. Vet's Choice has a sensitive skin or something like that. So, but the protein source in that is what we would often call a novel protein. So it's something like duck, or it's something like venison, although venison is not so novel anymore. We're seeing it in a lot more diets. But it needs to be something that your dog has not eaten, so that whatever is causing the allergy, it's often chicken, it can be beef, it can also be millies or maize. Thank you, Corin. It's now up to 12 weeks. It can be millies or maize. It can be anything that's in a diet that is causing this adverse skin reaction, which is an itch. So your dog itches. A lot of these dogs will also get ear infections. A lot of the food, the adverse food reactions will cause ear infections. So a little red flag, if you have a dog that has constant ear infections and is at the vet every couple of weeks or every 6 weeks for treatment, Has your vet done a dietary trial? Are you open to actually doing a dietary trial? It's important, because maybe if you change the food, the ear problem would go away. But I do digress, and this is a very big topic, and we will continue probably into the next Facebook Live. But the point I want to make is, it's a very, very complex, itchy skins can have many, many different contributing factors, and it can be caused by many different things. And as vets, in order for us to do our job properly, we need to actually be working our way through the possibilities and eliminating them one by one, so that we can get down to the correct diagnosis. Okay, it's not because we want to continue to spend your money. It's because really we want to get to the bottom of it, so that we can provide the correct treatment, and that way improve your dog's quality of life and your life. So if we have an itchy dog and we haven't attended to the diet, and the diet is causing the problem, and we put your dog onto medicine, the medicine is not the right thing. The right thing is to identify the food problem and change it if we can. Okay, so we've done flea allergy dermatitis, we've done cutaneous adverse allergic reactions or food reactions. Then we've got to look at, there are a number of parasites that dogs can have which cause itchy skins. And the first thing that springs to mind is sarcoptic mange. So it's caused by a mite, and there are a number of mites that could cause itchiness. So this is now the category we're talking about. But we would need to actually take a really deep skin scraping and check that under the microscope to make sure that your dog doesn't have sarcoptic mange, because the treatment for sarcoptic mange is not cortisone, and it's not any of the other new medicines that we're going to discuss at a later stage when we're talking about allergies. Okay, so if we haven't eliminated the possibility of a mite and we don't treat the mite, then we're going to spend a great deal of money on medicines that your dog probably doesn't need. What we should be spending money on is parasitic treatment. Okay, so we've got to do that. The fourth thing that we look at before we start talking about atopy is an allergic contact dermatitis. So usually that will also cause itchiness and redness, but often a contact dermatitis is the area where your dog comes into contact with the allergen, with the thing that's causing the problem. So often it will occur on the underside of the paws and not on the rest of the body. It won't affect the ears. Or if it's something like a contact allergy with a mat, and your dog lies on the mat, you're going to start to get the redness and the itchiness on the belly and under the arms, in the groin, because that's what's coming into contact with the problem. But the itchiness, we just see an itchy dog. Okay, so we need to be able to work through and say, okay, what is it? It's not easy always to find the allergen. In one instance, I remember having a dog that started with itchiness, and I started asking all these questions, and eventually the wife said, but we've put a new mat next to the bed. So then they started to try and work it back. Did the itchiness start with the introduction of the new mat? The long and the short of it is they removed the mat and the itchiness went away. It's very often not that simple. But if I hadn't asked those questions, then we would not have found the cause of the problem, and we could have, in those days, it would have been cortisone. I could have put that dog onto very long-term cortisone, and it was as simple as taking the new mat out of the bedroom. Okay, so it's a very complex, itchy skins is a very complex issue. Bathing in type of shampoo, Eileen says, I know people who bath their dog every week and also use human shampoo. Quite correct. Human shampoo, our skin pH is different to the skin pH of a dog, and we should not be using human shampoos on our dogs. Okay, I know some of you have got really good results, and I don't want to discuss it. I know I have a friend who's got a Yorkie that used to use Pantene because it was no more tangles, but it's not ideal. And be very careful. If your dog has a sensitive skin, we often think that a tea tree shampoo will help. Tea tree can actually exacerbate the inflammation. depending on how it's formulated in the shampoo. So we're going on a little bit of one of my side journeys here, which I love because of the comments. So so just be careful. I also had one client who had a little Maltese poodle that was very sensitive skin, and one day in the summer, pretty similar to where we are now, the hot weather had come and the dog just went completely red, frantic, itching, and she thought, oh, I've got this tea tree shampoo, it must soothe the dog, I'm going to help. And the dog went over the top, and literally within 20 minutes, and she had to bring the dog in, and we had to calm down that skin. Okay, so be very careful about the choices of shampoo that you use. And I would say that if you find one that works for your dog, then try and stick to that one. I know they don't always stay on the market. Thanks, Eileen, for that comment. So before we've even got to atopy or atopic dermatitis that is caused by allergens that the dogs inhale, we've already got to look at 4 different things that could be causing an itchy skin to allow us to eliminate those from the causes, or what could be the diagnosis. Okay, when we start talking about atopic dermatitis, this is where if I breathe in the pollen is presented to my body, or to in the dog's body, and the dog then forms an antibody to the pollen. And the more it is exposed to the pollen, the more antibodies are produced, the more the antibodies interact with certain white cells in our body, and we get a release of histamines, we get a release of eosinophils, and that's what causes the inflammation and the itch. Dogs that are very sensitive, or dogs that are prone to developing this type of hypersensitivity, this atopic dermatitis, there's a lot of other issues that they are finding also play a role with these dogs. So it's a very complex, multifactorial, the word they use is dysregulation. So it's poor regulation of the immune system. In other words, the immune system doesn't work like it should, and it becomes a problem. So what we also find with these dogs is because of this poor immune system, it's not just an over response to the allergen, but also the skin itself, the barrier that the skin forms from an immune perspective is poor. And what that means is that these dogs are also very sensitive to bacterial or microbial infection. Not always bacterial, it could be fungal as well. So a lot of these dogs end up with a secondary bacterial infection, which we have to treat. The environmental factors play a role. We've got skin barrier defects. So because the skin is genetically weakened, it opens it opens the dog up to, now we've got itchiness because of the allergen, and now we've got the skin barrier weakness, and now the bacteria can also overpopulate, or new ones can come in and cause a terrible pyoderma. So that's a really bad skin infection with a lot of pus. Okay, pyo. Okay, so as vets, we've also got to consider that things are perhaps not working as well as they should be for our patient. Okay, so I've already covered the most common allergens. We're looking at pollen, we're looking at dust mites, we're looking at grass, many, there's a panel that we can do to test a lot of fungi or molds within the house can also create a problem. And then certain medicines, certain insects, we've spoken about bees already, and certain foods. But then we're looking we're looking at a food allergy issue as well, as opposed to an atopy or a atopic problem. Okay, so we've covered what's happening in the body, and we've had some diversions, and yes, Eileen, good reason to keep a dog's paws clean for sure. And what it means when your dogs are accustomed to having their paws touched, start them when they're puppies. If you're keeping them clean and you're always checking, you're going to pick up an inflammation or something going on there sooner rather than later, and that means you can step in before it becomes a huge problem. Okay, very bad pododermatitis, big words, but when they become puffy and wet and infected and sore, and your dog doesn't want to walk and your dog can't stop licking. You don't want it to get to that point. So, as I suspected, I didn't put allergies part 1 here, but as I suspected, I thought we would end up talking more than once, like we did when we were talking about anti-inflammatories and supplements that we can use to help with joint pain. So I'm going to call it an end here, because the next thing I want to move into is how do we treat and what do we have to be aware of in order to appropriately treat these problems. And cortisone is no longer an appropriate medication for these dogs. So I'm going to end it there and just give a few more minutes for any more comments to come online. And I will see you again in 2 weeks. Next week I am examining poor students in the beautiful Plettenberg Bay, and I'm not going to be available. So in the middle of October we will be back, and I'll be talking about how do we treat allergies and what are the new medicines that are available to assist with this problem. Christine, thank you very much, and thank you everyone for your attention. Look after yourselves, have a fabulous weekend, and enjoy the summer.